I would like to make kind of statement about over-indebtedness, a rising problem in Europe. And if we combine over-indebtedness with poverty, which is also rising in Europe, we will have a very risky situation, a very bad situation. I come from Greece. Poverty and over-indebtedness is really a huge problem in Greece. We have become accustomed to seeing homeless people sleeping in the streets, hungry people getting their meals from charities. These things were not common in Greece because we have still families, and we do not leave our poor relatives in the streets. Unfortunately, we have this phenomenon now even in Greece. And I will tell you something that might shock you. We have parents, we see parents begging charity institutions to take in their children because these parents cannot feed their children. We are not talking about health, we are not talking about vaccines, we are not talking about education, we are talking about food. So, this is some kind of food for thought, while the European Commission is trying to find definitions, is trying to find data, is conducting surveys, which surveys need more data, but we do not get decisions. And people lose their houses, people lose their families. We need to talk about people and not about numbers. The previous panel analyzed the activities and the responsibilities of the banking institutions, the financial institutions, aggressive policies, misleading policies. So this panel is going to deal with advice. Can we prevent over-indebtedness through giving advice to consumers? Of course, and I will start with some questions to the panel. A lot of questions rise. Who gives the advice? Who pays for the advice? Is the advice independent? And how can we ensure the independency of the advisors? And also, a major concern. Is advice to consumers enough to prevent over-indebtedness, or do we need legislative measures to combat the activities of the financial institutions we talked about in the previous panel, and to deal with consumers' insolvency so that we have some future for the consumers? This is where I stop. I have spoken too much. And I give the floor to our first speaker, Mr. Richard Ahlström. I hope that I prefer your name correctly. He is an associate professor and head of the Department of Health and Welfare Studies in Malmö University in Sweden. Active in research in the field of over-indebtedness. He is working for the European Commission, Eurofound, Ministry of Social and Family Affairs in Ireland. I think that you have a lot of things to do, you do a lot of things, and he has a PhD in psychology, something that is very much needed for over-indebted consumers. Professor, the floor is yours.
Thank you very much for this very warm introduction. Ladies and gentlemen, we have a topic today that is a burning issue, as we all know, and it's a topic of over-indebtedness and how it affects, in my field, health, the social life, family life, and also what is the remains of one's own economy. So these are issues that I've been pursuing now for many, many years, and I will now talk about something quite different that has to do not with the causes or consequences, but I will talk about possible solutions for debt problems. And we talk about debt relief or debt settlement procedures. And the framework from which I'm talking about is the Nordic countries. We have a population of roughly about 25 million people in the Nordic countries. There has been something in the order of 100,000 debt reliefs by court, or what we say not amicable solutions. There's an unknown number of debt relief procedures outside the courts. We don't have any figures about that. So we talk about 100,000 cases where debt relief procedures has been introduced together in the Nordic countries. Surprisingly, there are very, very few studies about debt relief procedures, because this procedure started about 20 years ago in the Nordic countries. We have a few studies up till now, one from Finland, 2004, one from Norway, which is a very extensive, very good study. I think the author is here today, Christian Poppe. You might ask him questions about this particular issue. We have one that I did a couple of years ago with the co-writer Matthias Sauermark. It's focused about the mortality of, or let's say the death toll among people that are in debt relief procedures. And the fourth study is by Lisbeth Sandvall, who is also here with us today. And it's a qualitative study, a very interesting interview-based study that follows the process from starting of debt problems all the way to the, let's say, debt settlement procedures has been finalized. The fourth study that I'm going to talk about now briefly is by myself and two students I have. And it has just been published on the website, the homepage of the Swedish Consumer Agency, just a few days ago, also in an English version. Unfortunately, the link to this particular file is not present here in the slides I have, but we will try to get it into in the minutes of this conference. We have been looking into this particular study to see in what terms the health, the quality of life, and the financial situation and the experience itself of life during debt relief. And we have been also have a special focus concerning the significance of the debt advisory services. The debt advisory services in Sweden that are ruled by the municipalities is free and it's open to everyone. However, there are problems with the capacity. There are not much availability of these services, especially now when the amount of over-indebted people has raised quite dramatically in Sweden. This study is a fairly limited study. It contains about 13% of all the people who got approval of a debt settlement or debt relief application in year 2003. And it's a 5-year procedure like it is in the other Nordic countries. Debt relief is 5 years. And we got access of the data around 2010 and was then able to see and evaluate, are there any effects of rehabilitation? It thinks about health, it thinks about economy, about the social networks, the family, and so on. Because this is the critical issue when it comes to debt relief procedure. That's why we do it, to make people find a new start in life. And so the critical question is, do debt relief according to the Nordic model, does it help? We used a number of established instruments for health measurements like short form 36, and we also used a very well-known scale for suicidal risk behavior, Pekkip suicide scale, and also the hopelessness scale. These three scales are very widely accepted, globally speaking, and it gives a very nice opportunity to compare a specific target group, in this case the over-indebted people, with the normal population in the country you are making your observations. We also had, like I just told you, a certain focus on the debt advisory services and their efficiency in this process of debt relief. We made this study so it's effective 3 years after the debt relief procedure, the 5-year debt relief procedure has been gone through. And in this study employing 226 people, we can see that the health has not improved. There is an increase of sudden deaths. And there are also fairly high suicide rates. And we can also see that the social networking is still very restricted. People have lost friends, relatives, and also what is a little bit alarming in this study is that many parents who has gone through debt relief has had problem to maintain contact with their grown-up kids because there's simply not enough money to travel and see each other. About 90% of the cases in this study is complaining about this circumstance. During the years of being over-indebted and also during the years of being in debt relief, we can see that about 45% of people that was previously full-time working are not working anymore at all. They have left the labor market. And this is one of the big issues when it comes to over-indebtedness here in Europe, that people just don't have power to keep on working. And this, of course, creates great loss to society. People can't take part of life itself. Economists would complain that these people don't consume anymore, they pay less tax, and they are in a situation where they have, in many cases, lost hope. We see also that after this debt relief procedure has been finalized, people don't go back to what we can say a normal economical life in terms of taking loans, taking on credit. They don't buy real estate. They're in a kind of situation of frozenness. Because what I would say as a researcher, there is a fear to take any kind of economical decisions that might imply a risk. So when you think about restoration of people that has been in debt relief, speaking from this little study that is fairly restricted, we have to remember that it seems that it's a very, very complicated problem to get people back on their feet, let's say. And the main problem, as I see it, is that people in Sweden, it's the same in the most Nordic countries, that you have to wait. You have to wait, in this case in Sweden, about 8 to 10 years before you are taken in as an applicant for debt relief. So you have been living a life of over-indebtedness for many, many years. And that will then imply that health is at risk. And once you have developed what we call chronic illnesses, it's very difficult to cope with them, especially in this case in Sweden, when most people are already in their late 50s, when they are free of their debts. However, we must remember one thing, that most people that has now been through the debt relief, they feel a hope that their life might turn better. And one very critical aspect of this is the help they actually receive from the municipal budget advisors, because there are not many agents that help people in over-indebtedness. And also in Sweden, there was previous year a possibility to get support from by having a lawyer, for example, to take up your case into the court. And that was taken away more than 10 years ago. So we don't have advocates that fight in the courts for over-indebted people. So the people that helps people in Sweden and also in the Nordic countries are the budget advisors. Yes. Yes, so this is just a short introduction to the next features. So please, we move on forward.
Okay.
Yes. Yes.
Thank you very much. So, from what we have heard, over-indebtedness creates a non-reversible situation, social, personal, health situation, because of the long time that people live in debt. And you know what? We see this thing also in Greece. Our organization helps over-indebted people, yes. And we see it. They resign from life. Yes. So, it is crucial to prevent over-indebtedness. Mrs. Caroline Siarkiewicz is Executive Director of the Institute of Money Advisors and Head of Commercial Services at the Institute of Revenues, Rating and Valuation. She has worked for the Crown Prosecution Service and spent the first 12 years of her career at Halifax plc in sales, new business, staff and branch management roles. Mrs. Siarkiewicz, the floor is yours.
Conscious of time, so I'll try to talk through quite quickly. I think what I wanted to highlight here today is what's happening in the UK around over-indebtedness and what we're doing to try and help people actually get through their problems. I think the statistic that we just shared from Richard is very alarming, but what we're finding in the UK is that if we can get people to advice more quickly, then actually the chances of improving their lives and their outcomes much improves. And so one of the key drivers for us in the work that we do is around getting people to advice as early as we can. So I just want to talk a little bit about what the Money Advice Service is, what we do, about the debt sector across the UK, the impact of debt advice, and some good news, I hope, that I can share with you, and then what the sort of landscape looks like more generally. So one of the things that I guess we are quite fortunate in the UK to have is the Money Advice Service that actually was set up by statute. So an Act of Parliament required the setting up of an organisation to help people with their money. And that was set up in 2010. In 2012, what happened was that Act of Parliament was amended, so as well as looking after people's money matters generally, then a new responsibility was came upon us, which was to look after people who are over-indebted. And our responsibility is to raise the availability of that advice for them, to improve the quality of it, and actually make sure that wherever people go, they will get a consistently high, good quality service. Now, we are funded through a levy on the financial services industry. And that levy is a significant amount of money that comes into the Money Advice Service. So around £84 million comes into the Money Advice Service annually, of which 38 million is spent on our debt advice work. And what that money allows us to do is to fund a number of advice agencies across the UK that will offer free advice to people. So we have that in the framework of the UK, which I think is perhaps a little different from what happens in some of the countries here. Okay, so what I wanted to also talk a little bit about was a piece of research And I notice what the chair says about research, but actually, nevertheless, sometimes research can actually prompt some outcomes and some actions. And certainly this piece of research that we carried out did that. What we wanted to find out was, what is the number of people across the UK who are over-indebted? And we define over-indebtedness slightly different from some of the definitions that I've heard mentioned here. So what we are looking to identify are people who have credit commitments and they are behind with their bills for 3 months in the last 6 months. So these are people who have actually started to default. They've missed 3 of their payments in the last 6 months. So that's quite a hard measure that we can use to identify those people. The other measure that we use is actually asking people how they feel about their debts. And if they answer that their debts are a heavy burden, then we include those in the over-indebted number. And across the UK, that number is 8.8 million people. Huge. Almost 20% of the population of the UK are over-indebted if you use those measures. What we know about that population is that generally they are of working age. Majority of them are well under the age of 45. Interestingly, a higher proportion are women, but most of them are in work, which is also a feature of perhaps some of the conversations that have been had, I think, earlier on around contracts, 0-hour contracts, which are becoming very predominant in the UK. But their incomes are low. Generally, these people will have household incomes of lower than £20,000 per year, which is below the median. Most of them will actually own their own home with or without a mortgage, but there's quite a growing number of them that are renting privately, and I know housing tenure varies across Europe. 64% of them have actually fallen behind. So that's the hard measure. 64% of that 8.8 million people have actually fallen behind, and 66% are saying that it's a heavy burden. One of the other interesting things is that actually only 76% of that population would actually regard themselves as being in debt. And one of the things that actually is a challenge for us going forward, certainly in the UK, is to actually engage people with advice, because we know advice will help. But we have a difficult problem when only 76% of people actually would recognise themselves as being in debt. In the UK, this map just shows where the over-indebted population are, and you'll see the red areas are the areas where there is more over-indebtedness and across the UK, which will help us target where those services should be delivered. One of the things that we've been able to do at the Money Advice Service, because we have secure funding coming in, is that we can actually set up a 3-year funding arrangement with debt advice providers. Most of these advice providers are charities, and so it's actually difficult for them to have sustainable budgets so that they can plan their services. One of the things that the Money Advice Service has been able to do is to actually put in agreements so that they will have funding for a 3-year period, which enables them to develop and innovate their services. One of the things, and this is the good news story about advice, is that actually once people have got to advice, then 9 out of 10 of them will take an action. So they will stop burying their head in the sands, and they will start to engage and try and find a way through their situation. 80% of them, after 6 months, have started to reduce the amount that they owe to their creditors, which in itself is a very positive outcome for people, because they feel that the hopelessness of the situation is starting to change. 7 in 10 have had their creditors stop chasing them. So again, across Europe, there are a whole range of different debt collection activities. One of the things that actually stresses people out is some of those debt collection methods. But actually, once people are in advice, then 7 in 10 no longer have those creditors chasing them. And people start to feel less stressed and start to believe that their situation is improving. So this just shows actually a survey that we did in 2012 and the sort of cyclical nature of debt, but showing that once people had gone into the advice process, then debts were reducing and they were feeling better as a result. One of the things that we do at the Money Advice Service is we have a very sophisticated website and a set of web tools that people can use. And this is very much around actually improving people's knowledge and information, because one of the things that people are unaware of is actually what choices there are that they can make. How can they actually go somewhere and get some independent and impartial advice? And the Money Advice Service fills that space quite well. So we have a whole range of different tools that people can use to actually help them understand their money more, make it stretch further, and start to plan and save so that actually if there is an income shock, then they have something that they can start to rely on. We also have on our website an opportunity for people to put in where they live and actually find the nearest advice centre that can help them. And this is very much about driving people into the advice process because we know that it can help them. More broadly across the Money Advice Service, we have a new 10-year financial capability strategy, which is not just around debt, it's about the whole vision for financial capability across the piece. We have got some copies of this available on our website if anybody wants to download them. But what we're trying to do over a 10-year period, not just as the Money Advice Service, but working with other partners across the sector, is to actually improve the financial well-being. So quite a vision. And I think we will be going well into the 10 years to achieve it. But it's something that actually brings together all of the stakeholders. One of the things that's very important is that actually single organisations can't fix this. It's very much about working in partnership with others. So for us, as I said, the main challenge for us is around actually getting people to engage with advice. One of the things we know from our study Indebted Lives, and we'll leave some of these actually out on the table for people who want to take them away, is that of all of those 8.8 million people who need help, 83% of them are not coming forward to get advice. And I think, you know, that very much underlines the focus for our service and the debt advice providers in the UK is to engage with more people to get them into advice and into advice earlier so that the effects of being over-indebted can start to actually improve. Thank you.
We thank you, Mrs. Siarkiewicz, for giving us a more optimistic view of that settlement. And now I give the floor to Mr. Jan Siebols, who is project manager and initiator at Early Warning Project, this Vroeg op-af for the city of Amsterdam. He was a director at municipal banks in Leiden, Amsterdam. So, Mr. Siebols, the floor is yours.
Thank you very much. The pronunciation is vroeg erop af in Dutch. That's rather difficult. I'll explain you what vroeg erop af is in Holland, in Amsterdam. And vroeg erop af is a late payment early warning project in Amsterdam. Let's face the financial problems in Holland, and I think not only in Holland. So more than 50%, we heard it in the UK also, more than 50% of the debtors in Holland with serious financial problems don't seek for help because they think to find their own solution. They are rather optimistic, too optimistic, I think, and they wait and wait. They don't know the way to the debt advice. Many people in Amsterdam are not originally from Amsterdam, don't speak the language, can't even ask the way, and don't find the debt advice. And the last argument, they are too ashamed to ask for help. That's a big problem. And that's why we have Vroeg erop af in Amsterdam. And that's a large-scale project to localize beginning financial problems. You have to think 2 or 3 months delay of paying, and to organize a quick personal contact with the involved debtor. The signals from paying problems come from housing cooperatives. We've got 5 in Amsterdam, and they own 200,000 houses in Amsterdam. So many people in Amsterdam live in a house of a housing cooperative. We get signals from the energy companies and from health insurance companies. Let's look at the early warning when a signal comes from a creditor. Then we take action. And the needed actions are personal contact with the debtor. and a quick personal contact in 14 days. And the first thing to do when you have that contact is prevent a threatening sanction. That an eviction of the housing cooperatives, cut off of gas and electricity, a cancelling of the health insurance and so on. After that, specify the reason for the late payment. What's the reason? Can be several reasons, can be in divorce, problems with the health, drinking, gambling and so on. And afterwards, creating a fundament for a structural payment in the future. The intervention takes place by order of the City of Amsterdam. We don't have our own people, therefore. We buy this activity from several organizations. They work in parts of the City of Amsterdam, social welfare organizations. And their mission is personal contact into a few days. Make an action plan, and after that a warm transmission to the other providers of assistance if necessary, of course. Only in Amsterdam in 2013 we had more than 10,000 singles vroeger op af in Amsterdam, about 3,000 from the housing cooperatives, about 3,000 from the health insurance companies, 3,500 singles from energy companies, and more than 1,000 from other organizations. As I told you, there need to be a personal contact, and not only a personal contact. We want to have a serious conversation with the debtor about the cause of the problem and, of course, about the solution. And debtors with rent problems, we are able to reach 70% of the people with that serious conversation, and by other financial problems it's about 50%. That's quite a difference. Two reasons: people think problems with rent are more serious than the other problems, and another reason is we pay some more for the contact with debtors with rent problems, so there's also a financial thing in it. About 70% of the people we reach, we have that serious conversation with, didn't earlier have contact with a debt advisor or a social worker. That means that we have a total new group of clients, and I think otherwise they didn't reach the debt advice. And in about 50% the contacted debtor need long-time debt advice. It's so serious that a long-time debt advice is necessary. When I look at the profit of vroeger op af, the evictions, for example, nationwide the evictions in 2009 were about 6,000 times. That increased in 2013 about 7,000 times, an increase of 18%. And when I look at the situation in Amsterdam, 2009 it was 741, and in 2013 631. That's a decrease of 15%, and that's the early intervention. You see the results of it. It has also results for the housing cooperatives. In 73% of the people we get a signal of, there was a decreasing rent problem after a vroeger op af intervention. And the last sheet, the profit of vroeger op af is not only in Amsterdam. We had visit of the Minister of Social Affairs twice to our project, and last time it was in May this year. And she concluded, based on the social cost-benefit analysis, it's clear that the project vroeger op af has a strong positive rate of return. And for the City of Amsterdam, an investigation shows that every invested euro generates a profit of €2.22. Since that time, not only Vroeg op office in Amsterdam, but also in many other cities of Holland, and I think in about 2 or 3 years' time, it will be a nationwide project. Thank you.
We thank you. And I think that you have shown us that where political will exists, solutions exist also.
Absolutely.
Now we can come to Mr. Maxime Pekkip. He is working as a project manager at the Crésus Federation, responsible for preventive detection and coaching of the indebted. He is consultant and responsible for auditing banks, insurance companies, and public institutions, and he has also been working at Alliance Finance Conseil as a wealth advisor. He has worked in the private sector in many jobs. He holds a bachelor's degree in English literature, so we have the same degree, and a master's degree in international marketing and management from the Marc Bloch University in Strasbourg. The floor is yours.
Thank you very much. Thank you very much for allowing me to speak. So we solved a problem about preventive action and preventive action on over-indebtedness. Before 2008, we were organized when fighting over-indebtedness in France, a little bit like the strategy of the Maginot Line. We were expecting people to come to us with their problems. So in 2008, Crésus, who was already fighting over-indebtedness all over France, created the Crésus hub to coach over-indebted houses. We managed to collaborate with banks and other credit companies to elaborate detection strategy and process so that they are transmitted to us before any credit are getting unpaid. The profile of the people that we welcome at the Crésus hub are these ones. As you can see, there are many middle class. The average age is 55 years old. There are an average budget balance of 2,000 euro, and even with 2,000 euro, this balance is negative, with minus 7 euro without the alimentation, hygienist, and any other budget left. When we welcome this, when we coach these households, we start by doing the budgets with them. We do a budget analysis with all the items that are listed below, which are passed and scanned, in order to guide them to the and qualify them as A, B, or C, meaning early detection or the late detection. If it's too late, then we pass on a plan, over-indebtedness plan. If it's early, we can solve all the situation only with a simple coaching. Because you cannot find what you don't know what it looks like, we determined some detection items to help the banks and the insurance company or the other stakeholders to detect the people before it's too late. And they incremented this into their system, and this allowed to elaborate scoring to make detection and allow early detection of indebted people. As you can see, since we don't have any lenders registration in France, this lenders database in France, this stuff is even this job is even tougher, because what we contest is that between different banks they are not equally equipped, and it's harder for some banks to find early detections than for others. This leads to this kind of situation. As you can see, Over-indebted household in France isn't made in one day, it takes years. And what is worse is that it can be detected far before. In this case, 16 years would have been early detection. And the negative flagging came only after retirement. These items are used and are based on reste à vivre par unité de consommation. I don't know how to translate this, but what is left after all charges paid on the budget. And as you can see, we detect people early as low as 30% of indebted rate. We also developed automatic scoring and automatic diagnostic tools that we are ready to share with anyone who would like to replicate our model to the rest of Europe or rest of France. Thank you.
We also thank you for the information and also for being so brief. You know, Crésus is known in ancient Greek mythology as the king who was very, very rich, and he was boasting about his wealth, but finally he was to find death on the fire, and a wise man, a wise man from Greece told him that no one should be so boasting so much before his death. So I hope that you help people before the situations that Professor Ahlström described to us.
If you allow,
Yes.
Preventive action is never too soon. We also develop a game that we are going to export all over Europe, and I brought a video introducing it. If you allow me, it's just a short one.
I am sorry.
Sorry.
I'm sorry, I cannot allow this. We have 3 minutes before we finish this panel. I will allow 1 or 2 questions at the more, but very short, please. Yes, yes, sir.
That I have my name is Grzegorz Galusek, and I work for Poland-based Microfinance Center. I have a question to Richard. You know, those negative, this negative impact that you mentioned, this list, you know, just people threatened with suicides, etc. Would you attribute it actually to the over-indebtedness or the specificity of the debt relief program, which is quite long, and maybe you can reveal a few details of this program so that we have an idea, you know, just how it can itself, you know, just affect people.
Yes, I have a question. J'ai une question pour le représentant néerlandais. Votre initiative très intéressante et louable, mais comment est-ce que vous faites pour être compatible avec le secret des données personnelles si vous contactez les personnes concernées sur des indices qui sont fournis par les compagnies d'électricité et autres qui, en principe, doivent respecter le secret des données personnelles?
Well, our panelists have less than 1 minute to respond. Okay? We begin with
Yes.
Mr. Ahlström.
First of all, being in a debt relief in Sweden is a harsh life experience. You have to survive on about 13 euros per day for 5 years, and when the housing cost has been taken care of. So it means it's very difficult procedure to go through 5 years. Also, it's difficult to separate the effects of being long-term over-indebtedness from the period of being in debt relief. And this is something that I hope some will pursue in further research.
Okay, Mr. Siebols.
Yeah, our response in English, it's about the privacy, and that's quite a problem, that's sure. When it was only a small project, we had a philosophy, when there are financial problems, it's possible to hire a collection company. And so why it isn't possible to hire a welfare advisor, a debt advisor. Afterwards, when the project was growing, we had some serious investigation. And it's allowed. It's allowed for this kind of things, for the rent, for paying for energy, for paying for the health insurance. So it's investigated and officially allowed.
Thank you very much. We need to thank the following panel for giving us 5 more minutes. So, Mrs. Mader, you had a question?
Ma question s'adressait à Monsieur Ahlström sur ce qui a été fait à Malmö, parce que je trouve que ce qu'il nous a dit est extrêmement important. C'est extrêmement rare d'avoir des études de ce type. Nous avons souvent dénoncé dans les pays où il existe une législation, disons, cette période pendant laquelle les gens se désendettent et où ils ont simplement ce que l'on appelle un reste à vivre, c'est-à-dire en fait on leur alloue une certaine somme pour pouvoir vivre chaque mois, et on constate que comme cette somme n'évolue pas dans le temps, les personnes petit à petit ne peuvent plus, disons, assurer pour leurs enfants le minimum, disons, à quoi peuvent prétendre des adolescents, puis ensuite des jeunes gens qui font leurs études. Donc, par conséquent, il y a, disons, une grande misère morale et financière des personnes qui essayent de sortir en remboursant leurs dettes. Et j'ai été très, très intéressée par votre étude. Et je me demande à quelle conclusion vous êtes arrivé, enfin, qu'est-ce que vous avez pu faire, notamment vis-à-vis des autorités, pour arriver à les convaincre que vous ne pouviez pas rester dans cette situation. Parce que je pense que très largement, nous devons être convaincus de cela. Merci, monsieur.
Okay, I just want to make a comment on the German situation. We have 80 million inhabitants. We have roughly 1,000 debt counseling institutions in Germany. That means for 80,000 inhabitants, we have one institution. And our data and the waiting list for these institutions is on average half a year. So all the data available show that the institutions have a very high impact on a positive impact on health and becoming employed again. And I would really recommend this conference here to make these kind of impact analysis in each country to show the responsible politicians and all the others that debt advice is positive. As we have seen, it gives €2 or more back to the society. The investment is low and you get a lot out of it. Thank you.
We thank you. So, from the panel, who wishes to respond to Mrs. Mader's question?
When it comes to the consequences of debt relief procedures that doesn't work, it's once again up to the political willpower. We, as researchers, try to provide facts and figures about lives of over-indebtedness, with or without debt relief, and it's a political question, actually. It can't be solved otherwise.
Thank you, Professor. Well, we all know that we need political will. Without political will, we cannot face the problem of over-indebtedness or the problem of poverty. Advice is really important, but it cannot substitute legislation. We must be clear and we must be responsible. Financial institutions are institutions that need to gain money. So if we leave this sector without regulation, we have the problems we faced recently. So we need legislation. Consumers need simple products put on the market. Maybe we can see some kind of pre-market approval of financial products that consumers can understand and can deal with. We need to have advice, independent advice, and then if consumers get into trouble, we need to have mechanisms to deal with their debts. We cannot allow people getting excluded from society and from the financial, the markets, consumption, and things like that. I really think that it is a consumer's right to have help in this situation, as it is also a business's right to have insolvency procedures. I thank everybody, the panelists, the translators. So, Mr. Ivan Volis.
Thank you.
I thank you very much.